Ready? Let's talk about cirrhosis.
Okay.
What do you know about cirrhosis? Without reading your paper to me, obviously.
You drink a lot of alcohol and you damage your cells of your liver, you can't get that back.
And you can't get it back. All right. So the number one cause of what you're telling me is alcohol abuse. Damages your liver cells and they gone. What are your liver cells called? Stop that.
Oh,
Yeah, it's a really hard word. So hope you'll figure it out.
what are your liver cells called?
Mhm.
Hepatic cells.
Well, what's the name for cell?
Hepatocytes.
Oh, okay. So they're hepatocytes. That was hard. Yeah. All right. So cirrhosis means that over time you have drank and drank and drank. We know that alcohol is really hard on the liver. So it's going to ruin your liver cells. So then your liver is like, I can't take any blood anymore, right? What's the main blood supply to the liver? That's not true.
Portal vein.
The portal vein. Okay. So the portal vein,
Slow.
I know it's okay. It's early. The portal vein is going to give 75% of the liver's blood flow. Okay. And so it's going to be like, I can't take anything else because I'm already like cirrhotic and grody looking. Right. And then it's going to push back the blood to where? Everywhere else in the body. So they're going to get buildup of blood in weird places, right? Like in their butthole. That's a hemorrhoid. Yeah, that's true though. Okay. So what happens is this has to happen over time. I mean, Avi, you can't drink over the weekend and get cirrhosis. Like you had to have done this for a good amount of time. All right. And then the tissue in the liver, because it's just filled with alcohol instead of like nutrients, right? It's going to become fibrous. What does fibrous mean? Stiff, like kind of like scar tissue, and it's not going to work correctly. So the cells are going to die. The liver cells will die, right? And then that will form a completely scarred liver that does not work at all. Yes?
Yes.
Okay. So there are 4 different types. I don't care about them, but some people do. Alcoholic is obviously the number one. Okay. Any excess sugar that you take into the body, how does your body deal with it? What does it do with it? Like, let's say you eat a dozen Krispy Kreme donuts every morning. What's it going to use with the sugar immediately? What's it going to do? Taking a bunch of sugar, and then what happened?
Energy.
Okay. So it's going to go, the glucose is going to go into your cells. The oxygen's going to burn it for ATP, which turns into your energy, right? So it's going to use what it needs. And then what does it do next? Stores it in the liver and our big sugar storage. Remember, that's one of the functions. Sugar storage, no, glycogen stores, glycogen stores. And so when the sugar overflows that tower, then it just kind of like sits in the liver, right? And that any excess sugar will turn into fat. Okay. It'll store fat in your liver, which gives you a fatty liver. It'll store fat everywhere else in your body, especially likes to deposit around the midsection. Yes. Okay. So that's alcoholic cirrhosis. Then you've got post-necrotic cirrhosis. Necrotic means dead. So usually you have something really bad like hepatitis or something like that. The cells got necrotic, they died, and then they form scar tissue. We know that, right?
Yeah.
As cells die, they form. Okay. And then there is biliary cirrhosis. So what does biliary mean? What does that word mean?
Is that, I know there's a biliary duct.
Ah.
So is that like what's connecting? I don't know from where though.
It's okay.
Gallbladder?
Yeah. Yeah. So the biliary is going to be something gallbladder usually, because biliary means bile. What's bile's job?
To break down fat.
It emulsifies the fat, right? Do y'all remember the soap opera of the GI system?
The liver, the gallbladder, and like the big daddy.
They're all Marius.
Yeah.
Oh, we need to do it again really
Yeah.
quick. Okay.
Please.
I'll sit down. I'm going to show you biliary.
That's the liver.
Oh, you don't even know who the big daddy is? Okay. So,
It's the liver.
okay. We're going to do this super, super fast. Okay. All right. So this is the liver. Good job. And this is
Big Daddy.
Big Daddy. All right. And he thinks he's like the absolute shit. Yes.
Yes.
Okay. So he's going to take up a little wife. Who's the little wife that's all up underneath him?
Gallbladder.
That's the gallbladder, right? Because she's like right up underneath him. Now all of these ducts are going to connect, right? You can see like the green one. That's a hepatic duct that connects here. You'll see that. Okay. So who makes the money?
Oh.
Big Daddy, obviously, right? He makes all the money and then he gives it to store, and then she spends it whenever she wants, right? Okay, what's the money? The bile, right? So liver makes the bile, gives it to the gallbladder. It sits in the gallbladder. And whenever you eat a
Fatty.
high fat meal, then it's going to release the bile, right?
Mhm.
All right. So they're married for a while, right? Everybody's happy, but he's not, right?
Yeah.
You cannot be satisfied. Okay. So they decide to,
Get
Or
it? Yeah.
divorce.
Get.
no, they're not divorcing.
Side piece?
No, not side piece.
Oh.
Polyamorous.
Polyamorous relationship. They want to take a sister wife. Okay. So who is the sister wife? The pancreas, the big giant penis here. Yes. Okay. Excuse me, phallic looking object. So they're like, oh, hey, what's up? Want to do a triangle? Okay. So they are all going to get married. Yes. And they're all connected, right? You see the hepatic portal vein goes down here. You got the common bile duct. They're all connected by ducts. So if you piss off one,
You piss them all
you
off.
piss them all off. They're all going to be angry because they're like, all together. Oh, I love you. Okay. And then Big Daddy, was he happy with that? No, he still wanted more. So who'd he get?
Kidneys?
The kidneys. The kidneys are the side pieces, right?
Mhm.
Doesn't use them all the time, but if he goes down, like kidneys are going down with him. That's called hepatorenal syndrome, because the liver's job is to break down certain waste products in a way that the kidney can get rid of it without damage, right?
Mhm.
Like, give me an example.
Like urea.
Like uric acid.
Uric acid.
I know that's what you meant. So if we sent uric acid straight to the kidneys, they don't feel good peeing out straight acid.
Mhm.
So the uric acid goes to the
Liver.
liver, breaks down into urea, and then gets it to the kidneys all nicely. Okay. Do we understand what I'm saying?
Yes.
All right. This is very important, because a lot of the signs and symptoms of like pancreatitis will look like some of the signs and symptoms of cirrhosis, will look like some of the gallbladders, because they're all connected by ducts. Do you make one mad?
Make them all mad.
Do we understand?
Yes.
Okay. All right. So with that in mind, the biliary cirrhosis is some kind of an obstruction. So there's an obstruction in one of these ducts here, right?
Mhm.
Which is going to make the liver very angry, swell, get upset, right? Because all of those ducts, what does a duct do? Drainage. It's a drainage system. So it's a way for the liver to get things to the gallbladder, the gallbladder to get things to the pancreas, and then the pancreas dumps into the intestines.
Okay.
Okay. All right. And then there is cardiac cirrhosis. What is cardiac cirrhosis? Okay. How did heart failure cause cardiac cirrhosis?
The blood.
I like it when y'all just say something to me off the page and then I ask you why you don't know. What?
The blood being pumped from the heart to the liver.
The what? The blood pumps out of the heart to the left side, boo-boo. Okay. Okay.
There's an obstruction. Liver's not heavy.
Okay. So I'm just going to tell you. All right. So the liver, we know like it will connect to, it's all the blood supply as it goes through the liver. It's going to go up the
Oh.
inferior vena cava and into the heart.
Yeah.
So if you have right-sided heart failure, that blood will back up directly into the liver.
I remember now.
Oh, okay. We just got to get moving a little. All right. So that's the 4 different types. Are we clear?
Yes.
All right. Biggest risk factors for cirrhosis are obviously excessive alcohol use. We know this.
Mhm.
Fatty liver disease, because your cells are going to fill with fat. They don't work so good. Yeah.
Yeah.
Okay. Malnutrition. Why would malnutrition cause cirrhosis? How do you know somebody's malnourished? What's the lab that we run? Albumin. Whose job is it to make albumin? Oh, it's the liver's job. So it's working overtime, right? Trying to make all these different things, because it's got to make sugar stores if you're not bringing in any sugar, right? It has to make albumin if you're not bringing in any protein. It's working overtime. And then hepatitis. What's hepatitis? Inflammation of the liver. And there's different ways that it could be. You could just have flat hepatitis, which is just, it's angry for some reason. Or you could have hepatitis A, B, C. There's also a D, an E, an F, and a G. Okay. But we're only learning the top 3 today. There are some genetic factors that can cause cirrhosis, but it is not like genetic, like you're not just going to, yeah. There has to be like some other lifestyle factors go along with it. It's more likely in males, because males usually drink more, but now the women are starting to step up and we're starting to see a lot more. I don't mean that in a good way. We're starting to see more women getting cirrhosis as well. All right, top 4 things to avoid in any patient that has any type of liver problem, whether it's hepatitis or fatty liver or cirrhosis, is acetaminophen, which is Tylenol. How come?
It's just hard on the liver.
It's liver toxic, right? So probably ought not.
Probably ought not.
Okay. Alcohol, because it is liver toxic. Aspirin, do not see it as liver toxic. Why would a patient with cirrhosis avoid aspirin? What?
I don't know.
I mean, it is kidney toxic, but this is the liver that we're speaking
Yeah,
of.
should do something in blood.
Kind of, yes. It's not a blood thinner, but what's the liver's job in regards to blood? What does it do? It makes some cells, doesn't it?
Oh yeah.
Red
Okay,
blood cell,
makes
white
red blood cells, white
Oh,
blood
yeah.
cells, and platelets. Okay, so platelets are responsible for clotting. Okay, it also makes vitamin K, which is responsible for clotting. Okay, it also makes clotting factors. So all our liver patients bleed. What?
All our liver patients bleed.
Okay, all of them. Meaning by the end, like an end result of any kind of severe liver disorder, these patients are bleeding out of every orifice. They will have nosebleeds. They will have rectal bleeding. They will have blood in the urine. They bleed because there's no clotting factors, no platelets, like it's, and no vitamin K. So you're gonna bleed. Okay. Two big things you need to know about liver is all our liver patients bleed and all of our liver patients itch because all those waste products are going to start building up underneath the skin. So they get major skin issues as well. So avoid aspirin because what is aspirin? It's not a blood thinner, so don't even go there. It is an no, it is not.
It's the opposite.
It is, no, ma'am. It is an aspirin? Really?
I know.
An okay, it's an antiplatelet aggregator. It makes your platelets not stick together. So if in cirrhosis, you're not even making platelets very well, and then the ones you are making, you're taking aspirin, they're not sticking together, that's going to make you bleed more. Yeah.
Yeah.
Okay. Why would you not avoid NSAIDs, period? They're not a blood thinner, but they can increase your risk of bleeding because they make your platelets not stick together.
Okay.
If y'all come up in here and
It's
say
also-
NSAIDs or aspirins or blood thinner, whoop your ass. Okay.
Is it
So-
also an antiplatelet aggregator?
Yeah, NSAIDs are. NSAID, most of them are. Okay. So do you see why we would avoid those big four things?
Yes.
All right. So let's talk about how we would diagnose cirrhosis. First, we're going to do LFTs. Don't look at your paper, which include Alkphos, ALT, and AST.
Is ALK? What's ALK?
ALK is Alkphos, which you've done already said.
Oh, yeah,
Okay.
that's-
So Alkphos, ALT, and AST. Those are called our LFTs, which are liver function
Function.
test. All right. Turn your papers over. I'm going to ask you a lab and you're going to tell me what you think would happen with cirrhosis. You have to know the functions of the liver. Okay.
Okay.
Bilirubin.
Wait, what are you asking?
I'm going to give you a lab and you're going to tell me whether it's high or low.
Oh, okay.
I know I already gave y'all instructions. Bilirubin. That's going to be high because the liver's job is to get rid of bilirubin. B1 and creatinine. Those are going to be high, but give me a rationale.
Because they're married.
Okay, but I need a real rationale. You're going to write on your paper at your exam because they're married.
Well, if the liver's not working properly and sending stuff to the kidneys.
All right, so if the liver isn't working properly, it's not breaking down waste. So it's sending stuff to the kidney that's just
Oh,
going to
yeah.
tear up the kidney. Yeah. Okay. Albumin. That's going to be decreased because the liver's job is to make albumin. If it's broken, it can't make albumin. There's never a time where albumin is going to be high. Okay. White blood cells, low because the liver. Hemoglobin and hematocrit, low because the liver makes red blood cells. Platelets, low because the liver makes platelets. Vitamin K, low because the liver makes vitamin K. So they're going to be at risk of bleeding. Vitamin B, that's going to be low because the liver's job is to make
Healthy vitamin B12.
all Bs,
All
right?
Bs.
And what are the two jobs of B vitamins? Number one,
Make healthy cells.
healthy red blood cells.
And
This is very important for cirrhosis, so I'm not going to tell you. Why do they tell you to take B vitamins? Hmm.
This may be way wrong.
That doesn't have something to do with folic acid.
But I'm not mad at you because folic acid is similar.
Okay.
Okay, I'm just gonna tell you because I don't have time to wait for y'all today. So B vitamin's job is to make healthy red blood cells, which they usually say like, go get a vitamin B12 injection, right? It gives you energy. Well, it gives you energy because it helps you to make better red blood cells, which give you more oxygen, which makes you feel better because you have more ATP, right?
Mhm.
Okay. So B vitamins make healthy red blood cells. Okay. And they make healthy nerves. What?
Healthy nerves.
Healthy nerves, which is why patients that are alcoholics, they shake a lot, right? I mean, part of that's probably DTs, but they have neuropathies really bad, right? So they may not be able to feel their hands and feet. They get tingling and numbness because your B vitamins are not being made. Yeah.
Yeah.
Okay. What about your PT?
It'd be down.
It's a time. It's the time it takes you to clot. So how much time does it take them to clot?
A
A lot longer. So that would be elevated. Do we understand?
Yeah.
All right. Okay. So, but in order to absolutely see what the cells look like, we're going to have to, the liver cells, sorry, to see what the liver cells look like. See if we have, so we're going to have to cut off a piece of the liver. Now, very important. This is always on NCLEX. When a patient comes back from a liver biopsy, how do you position the patient? Now think, all our liver patients bleed first and foremost, then you're cutting off a piece of their liver. So what's their big risk? Bleeding, right? So how do you position your patient after they come back from a liver biopsy?
On the left side?
Go the other way.
Oh, right side?
Yes, because you want to put pressure on it. So you're going to put them on the right side so that there's like their body is the pressure against it.
Okay.
Do you understand? Okay. All right. Other things that we can do to diagnose cirrhosis, we can draw albumin levels, which will be low. What's a normal albumin level? 3.5 to 5 or 3.5 to 4.5 is fine. All right. We will do a hepatitis B and C antibody test. Why am I doing that? How'd they get cirrhosis? I don't know.
To rule it out.
Right? Yeah. To rule it out and to see, like, because remember, chronic hepatitis can also cause cirrhosis. So I need to find out, is this a hepatitis issue? Because I can help fix hepatitis. I can't cure it, obviously, but I can work with that, right? All right. We are going to do an ANA. What's an ANA?
Autoimmune test.
Yes. So an ANA stands for anti-nuclear antibody. And what does an ANA test tell me? No, it just tells me that they have an autoimmune disorder. Does it tell me which one? No. So then I have to go looking, but there is an autoimmune hepatitis, right? There's lots of different autoimmune. So that's why we're running that. Okay. We can do an MRI or a CT. We can do lots of different things just to see what's going on with the liver. Do you understand?
Yes.
All right. Let's talk about complications of cirrhosis. Why do we make such a big deal about it? They can get hepatorenal syndrome. What is that?
Neither one are working.
All right. So that means that the liver is dying. So that means that the kidney is going to die too. And they're going to go into what looks like, no, it's not acute, right? This is happening over time. So it's going to look like the kidneys are failing over time, right? So it's going to present as, yes, CKD. Thank you.
Oh.
I swear when y'all don't know something, y'all just sit there and go blank. Like, it's not even like you want to think about it. You just like, I hope it comes to me. Okay. What is esophageal varices? That's another complication.
Varices?
Esophageal varices.
I don't know that word.
Okay. Think of it like varicose, varices.
So it's like going the wrong way, maybe?
Okay. Have y'all ever heard of varicose veins?
Yeah.
Okay. Y'all got to start putting these connections
That's
together.
when the blood goes up the wrong way. Or, right?
Goes up the wrong way. What do you mean? What are varicose veins? Y'all have seen them? Yes. What do they look like? Where do we usually see them?
Legs.
Big, giant, tortuous vessels, usually in the legs, right? Because that's just stasis of blood backing up, right?
Yeah.
That they have that, but it's in the esophagus. So what's their risk? Big, giant blood vessels in the esophagus?
Respiration.
No, maybe. Y'all, I don't know what is going on today, but it's like, I'm very worried about you. Okay, so if I have
Choking?
big, giant, tortuous vessels inside my esophagus, and let's say I swallow a tortilla chip.
Choking. Oh, rupture?
Yes, they will rupture and you will bleed to death.
Oh, that's okay.
Yeah. Oh, that's terrible. That's probably worse than the other things I said. Okay. What is hepatic encephalopathy? That's another complication. What about the brain?
Ammonia.
All right. So one of the jobs of the liver, remember, is to break down ammonia. If the liver can't break something down, it will first send it to the
Kidneys?
brain. Then it will send it to the kidneys. Okay. So it'll send it just to sit. It'll just send it to sit.
Okay.
Okay. So how do you think your brain feels with just sitting in ammonia?
Horrible.
Horrible. So what's the first sign and symptom of hepatic encephalopathy?
Confusion.
Confusion. If you have a cirrhosis patient that has new onset confusion, you need to think ammonia. And what's the test we do at the bedside for high ammonia levels?
Isn't that blood?
Pardon? No, it's something that you can do with your hands
Yeah.
to the patient.
This thing.
This thing,
I don't remember what it's called.
what do? You take the hand and you're going to pull back and then you're going to
It's gonna
let go. And if they have it, they're going to, well, it starts with an A. And then an S. And then a T. And then a E. Oh my God. I can't give you any more than that. I'm sorry. Yes, you can write it down. Just start praying. R. If you don't know by now, you just don't know it. It's asterixis. No, you didn't know it. Don't act like y'all knew that. Okay. And I know I covered it in detail. So, all right. Complications of cirrhosis, liver failure. Okay. Obviously the whole thing's just gonna, you gone.
Yeah.
Why do our liver patients bleed?
It's not making albumin, vitamin K.
Not albumin, but
Vitamin K.
vitamin K, which clots. What else?
The clotting factors.
Clotting factors and one more.
Um,
What are your cells that clot?
platelets.
Platelets. Okay. All right. What about ascites? Tell me about ascites. What is that?
That's when a bunch of fluid is out.
All right. So there's a bunch of fluid in the abdomen. And why does that happen with cirrhosis?
So back up from the vein.
Oh my God, where'd you come from? Little lady, look at you saying some correct things. So we
You
know,
may have taught me something.
okay, you know the main blood supply to the liver is the portal
Portal
vein. Okay, so all of the, well, not, I can't say all, but like 75% of the blood flow is going through the portal vein. I'm actually gonna have to draw this, I think, because I didn't draw the, well, I didn't draw this anyway, because I can't draw. Hold on. Okay, so. All right, so this is the liver, and your main blood supply to the liver is the
Portal vein.
portal vein. So you have a huge, because your liver is very large, eh?
Mm-hmm. Yeah.
You have a huge amount of blood flow that's going through the portal vein up into the liver, right?
Mhm.
Okay, but your liver says,
I don't want you.
I'm already full, so it's going to push back, right? So now you have tons of blood in the portal vein. What's that called? Lots of blood, lots of pressure. It's called,
Hypertension.
and put the name of it.
Portal hypertension.
Portal hypertension. Okay, so this is portal hypertension. Anytime your body changes pressure in a vessel, it says something is wrong and it's going to leak into the third space. And that, where is the liver located? Right
Right. Upper.
here. And so where's the third space? Right
Yeah.
here. Okay, so that's one reason why you have ascites. Second reason why you have ascites is a low albumin. How come? What's albumin's job?
Pulls fluid into the vessel.
Keeps fluid in the vessel. You don't have a lot of albumin though. So where's the fluid going? Outside the vessel. Good job. That was a good one. All right. Do we understand the basics of cirrhosis?
Yes.
All right. We're going to talk about cirrhosis. I had to do this a little bit differently because there's so much information. So how we're going to do it is there are signs and symptoms here. There's treatment for these signs and symptoms, and then there's the nursing care. Okay. All right. So y'all should be able to form a rationale for everyone. This is all going based off patho. Like patho is really important.
Mhm.
Yeah. All right. So Fluid balance. What does cirrhosis do with fluid balance? All right. Patients with cirrhosis get peripheral edema. How come?
I saw this.
Oh.
the other day.
Oh, you did.
Because of the albumin.
Thank you. So because the liver makes albumin, but it's not making albumin very well. So can the fluid stay in the vessel?
Yeah.
No, it's going to third space, causing peripheral edema. Okay. They're going to get ascites. Where did ascites come from? Number one, portal hypertension. Number two,
Something like that.
low albumin.
Oh.
Correct. Okay. They're going to have changes in weight. Now they may have weight gain if they're obviously retaining fluid, right? They may have weight loss because a lot of people, if they are alcoholics, will drink instead of eat. And so they end up being very malnourished because your body can't make albumin at that point. So it can't even make protein to keep you nourished.
Okay.
Okay. What is hypoalbuminemia?
Low albumin. in the
Low
blood.
albumin in the blood. Okay. They may go into fluid volume overload. How so?
'Cause all of that is space.
It's third space fluid. They can't get rid of it. You can't pee out third space fluid.
Mhm.
It doesn't just eke out of your skin. Well, actually it kind of does. All right. So what's a treatment? How do we get rid of all this excess fluid? We can manually remove it with a paracentesis. What's a paracentesis? Anytime you see centesis, that means you're removing something. Okay. So we're going to do a paracentesis where we actually take a needle, put it into the abdominal cavity or the peritoneal cavity. Okay. And then we're going to remove the fluid.
Wow.
Yeah. How do you position your patient when they're doing that?
Would you put pressure on them?
No, they're sitting here with the big old giant ass belly, right?
No.
Okay.
Flat?
No, is it when they're like
It's leaning
over?
forward. Okay. Because like, think of how you're sitting right now. Y'all are like super skinny. So you probably don't have like any rolls at all. But like, if you lean over this way, obviously everybody has like rolls when you lean over, right? So, cause that brings all the fluid to the front. Like if you want to look like hot and sexy when you're about to like do sexy time, you lay flat because it like makes your tummy really flat. You know what I mean? So we don't want that. We want to collect all the fluid in one spot, right? So that we can tap it. Cause I can't dig around with a needle. So we're going to put them forward so that all the fluid comes forward in one spot. Are we clear?
Yes.
Okay. We can also use Lasix, diuretic, right? To get rid of some of the fluid. Spironolactone, what type of diuretic is that?
Potassium sparing.
It's potassium sparing. Triamterene is the same. Okay. What is HCTZ? Okay. It's hydrochlorothiazide, which is a weak diuretic, but it's a diuretic nonetheless. Okay. We can also give them IV albumin. How would that be helpful?
To pull that fluid
It's going to
into
pull
the
that fluid into the vessel, but then you're still going to have to give them a diuretic. Otherwise you're pulling shit tons of fluid into the vessel and they're going to have massive hypertension. Yeah.
Yeah.
Okay. So nursing care, what's the best way that we can determine this patient's fluid volume status? Daily weight. We will do eyes and nose, but nobody cares so much about those. Okay. We're going to watch their albumin levels, normal albumin levels, 3.5 to let's say 4.5 this time. Okay. We're going to watch for edema. Why am I auscultating for crackles? That means that there's extra fluid in the lungs, and what's the risk? Pneumonia, right? So I'm going to report that. Why would we put these patients on a low sodium diet?
Because water follows salt.
Water follows salt. And so if they have a higher salt diet, that's going to cause more fluid retention. Yeah.
Yeah.
Okay. And you might put them on a fluid restriction if they're retaining a lot of fluid. Okay. All right. Do we understand that function?
Yes.
All right. Let's do neuro next. What is hepatic encephalopathy?
Ammonia buildup in the brain.
All right. So that's ammonia because the liver can't get rid of the ammonia. It's going to send it to the brain. First sign and symptom of hepatic encephalopathy. Confusion. What's the drug treatment? Drug of choice for hepatic encephalopathy? I've asked all this so many times. I do not even know how to help you anymore. There are two drugs. Yep. This is always on. Drugs of choice for hepatic encephalopathy. I just asked you in the antibiotic module too. And y'all were like, oh, this is so hard. I can't quite remember. So I thought this time would be different. Because one of them's an
Is it the
antibiotic.
one that makes you poop?
Well, all of the antibiotics make you poop, but
Mycin
what?
would be like neomycin.
Neomycin and thank you
Starts with an L.
for saving me. And it does make you poop. That one makes you poop.
Lactose.
Lactulose. Thank you.
Oh,
She's new. All right. So lactulose and neomycin are the drugs of choice for hepatic encephalopathy because it makes you poop out all the ammonia. Yeah.
Yes.
Okay. Asterixis. Oh, what's that? What? Oh, okay. So that's a test you can do at the bedside where you pull the patient's hand back and let go. And if their hand starts a flapping like this, that is called Asterixis, and that tells me they have high ammonia. I'm still going to draw ammonia levels, obvi, but that at least tells me immediately, and I can contact the physician. Why would a patient with cirrhosis have peripheral neuropathies?
That
We just went over it. Okay. What are peripheral neuropathies?
it's like you don't have enough or poor blood flow.
It's not peripheral.
With the nerves.
It has to do with the nerves. Okay, peripheral
So-
neuropathy is where you can't feel or you get tingling or there's numbness. So why would they have that?
Low B12.
Low B vitamins in general,
Okay.
right? B vitamins do two things. Number one,
Make healthy cells.
healthy red blood cells, and they do nerve health, right? So if you are a cirrhosis patient and your liver cannot make B vitamins, therefore you're going to have unhealthy nerves causing peripheral neuropathies. Yeah. Okay. So for the two drugs of choice for hepatic encephalopathy,
Neomycin and
lactulose and neomycin. We're also going to put the patient on a B complex vitamin. How come?
For the nerves.
I'm sorry. Could you speak louder than this?
For the nerves.
Oh, okay. So let's give them some healthy nerves, shall we? What is gabapentin? You've heard of this, yes?
Yeah, it's like a pain. I know
It's a
some
pain
people-
medicine that does nerve pain.
Okay.
Oh, because remember, nerve pain is a totally different type of pain, right? Yeah. Okay. Okay. So if they are, I gave y'all some signs and symptoms at the top for hepatic encephalopathy. So on top of confusion, they may also have memory loss, depression, insomnia. They may get really agitated. They'll get frequent hiccups. If you have a cirrhosis patient, it's like, you better check their ammonia levels. That's wild, huh?
Yeah.
I know. They're going to have increased DTRs. What are DTRs? Right. So when you take the little hammer and you go on their knee, it's going to be like, woo, like this, like massive. Do you know your deep tendon reflexes come from your neurological system?
Yeah. Got it.
Okay. And then they may have a positive Babinski. What's a Babinski? Mhm. Yes. So how do you speak into me? You got this. Y'all just give me keywords. And I think y'all should be like toes. Yes.
It's like where the toes flare in, right?
Or out. Yes.
Out.
So you're going to stroke the bottom of the foot and then the toes are going to, we do this on babies. So babies have a positive Babinski because their neurological systems are immature. So you're going to take your finger. Have you ever done this to a baby? And like their feet go crazy. I'm like, okay. So I did this to him the other day. She's mad. So you stroke the bottom of the foot and the big toe is going to dorsiflex and the rest of the toes are going to fan out. That means that you have an immature brain. That's fine because she's immature, right?
Yeah.
But if I did it to an adult, oh shit,
Yeah.
it's like a primitive reflex. Like it means that your brain like automatically does it. And it means that the brain is very immature. Well, if it's an adult, I don't want an immature brain. I might just sit and hold this one. I bought a cuter one and bring her. Anyways, y'all will see her next time. I bought one of those real babies. You know what I'm talking about?
Oh yeah.
Like a real baby. Like it's real.
Is it poop and stuff?
Oh, no, not like that. Like it looks like if you didn't know that it was a doll, like you would look at it and think it was 100% a real baby. I have to show you all this really quick. It is the most cutest thing. This lady makes them and she hand paints them.
Oh.
I know it has nothing to do with any of this. Like, I'm just, and my kids are like obsessed with her. Does she look real?
Yeah.
Absolutely.
And then she's heavy. Like it's like a heavy baby. They have like floppy necks. Like they are like real babies.
Someone makes that? Like
Yeah, like hand paints them. I know. Anyway, so okay. Where was I? Okay, so we're going to monitor neuro status. Any of our liver patients, you have to watch neuro, which means we're obviously going to do like neuro checks, seizure precautions, right? Right. It is highly important that you report a change in level of consciousness or you report new onset confusion. That's a big deal with cirrhosis. Okay. We're going to do diabetic foot care. They're not diabetic, but y'all know what that means. Okay. Well, what? Just so I can make sure.
you check it all the time.
All right. So you're going to check their feet. They have to do a daily inspection of their feet with a mirror. No sandals, firm soled shoes, no extremes of hot or cold.
White socks.
White cotton socks. Okay. All right. Do we understand the neuro portion?
Yes.
All right. Next is the portal hypertension. All right. So what do we say portal hypertension was?
And the back
It's a backflow of blood to it's got to go somewhere, right? Because they put a ton of blood into the portal vein. Well, it can't accommodate that either. So it's just going to kind of send a little bit to the rest of the body to evenly distribute it, right? But it doesn't really get evenly distributed. Obviously, it builds up in these big giant vessels. Okay. So what is esophageal varices? Big tortuous veins inside the esophagus. What's your biggest risk? Bleeding. It'll rupture and you will die most of the time. All right, hemorrhoids, that's in your butthole, right? So that is big engorged tortuous vessels in your butthole. Gastric varices, where are those at? In your stomach. What happens if you take aspirin or you eat some irritating foods? Oh no, those are going to rupture in your stomach or drink alcohol. Oh no. Caput medusae, what is this? You know who Medusa is?
Yeah.
Well, what does she look like?
Like snakes on it.
Yeah, those big crazy snakes. So your vessels look like that, but around your belly button.
Oh.
I will show you.
Okay.
This wild. So if you like pull up the shirt of a patient with, I'm sure over here first so that you can see it. It's gonna look like this. I mean, that's severe, obviously.
Yeah.
Okay. But at the beginning, it'll look something like this.
Oh.
Because it's just backing up around. That's called caput medusae around the belly button. Okay. And then eventually, obviously, spread to the whole abdomen. Okay. Okay. Ascites. Where did we get ascites? From the portal hypertension and low albumin, right? Because albumin's job is to keep fluid in the vessels, but we're not making any, so it's going to go out. Okay. Splenomegaly. Why would they get a big old mega giant spleen? But why is there fluid in there? Huh? Pardon?
Go ahead.
Okay.
You got it.
She said, you got it. And she's like, I'm not sure that I do. Hello? No, ma'am. Okay, your turn.
Yes. Like all the extra blood is going.
No.
Just send that fluid.
I mean, it's not fluid. I guess it's not the extra blood that's going there. I guess it kind of is, but so can you see right here, this vessel right here? This goes all the way over here to the spleen. So there's a direct connection between the liver and the spleen, probably another side piece, to be honest. So if the liver is all engorged and big with fluid and, has cirrhosis, then a lot of that fluid and blood will back up directly through these into the spleen. That's why most patients, when they have hepatomegaly, they're almost always going to have splenomegaly. That's why we call it hepatosplenomegaly.
Okay.
Right? Okay. Yeah, so that happened. Let's see. Okay, so how are we going to fix this? Portal hypertension. Now there's extra blood everywhere else. Yeah. Okay. We may give propranolol. What is propranolol? It does decrease heart rate. It also decreases blood pressure. So do you want high pressure in these big giant tortuous vessels in the esophagus? No. So we're going to lower the pressure so it decreases the risk of rupture. Thank you. Witch hazel and steroid cream, where does that go? On your butthole. Yeah. A paracentesis we already talked about, right? That can help get rid of some of the ascites. What are sitz baths?
The thing where you like squat.
Yeah, you squat and then you like splash water on your booty hole. Yes, and it helps to relieve some of the pain from the hemorrhoids. Okay, you can also just sit in a couple inches of water, but you got to squat, otherwise it can't get. Okay. A TIPS procedure I'm going to talk about in a bit, but it basically is a shunt that will shunt some blood away from the portal vein so it doesn't get quite such high pressure. I'll talk about that more later. Do you know what a balloon tamponade is? Okay, well, how do you stop something from bleeding? If anything is bleeding, how do you stop it? You put pressure on it. Okay, but how would you put pressure on your esophagus? You would murder someone. So we can't go from the outside in. So we're going to go from the inside out. So they'll put in a balloon into the esophagus, blow up the balloon, and it'll put pressure on the varices. Okay. And I'll talk more about that later too. It is vital that you put your liver patients on bleeding precautions, right? Because all our liver patients bleed. How would you know they had a ruptured varices? Yes, they will. But how do you know?
If you're bleeding, they start choking.
Not choking per se, but where does your esophagus go?
Aspirin.
Where does your esophagus go? Into your stomach. So then their blood starts, oh shit. Their stomach starts to fill with blood, and then they're gonna,
Pumping blood?
no, they're not, we don't have time for that.
Okay. So
They're gonna start vomiting copious amounts of blood, like exorcism, blah, whatever. It is intense. It is violent. And then when you throw up, obviously that increases pressure in here. It's going to make it bleed more. If you have a patient that has cirrhosis and they have a ruptured varices, you need to call rapid immediately because that patient will bleed to death in a very short period of time. And you're probably going to need some help. Now, once they start vomiting blood, yes, aspiration would be a risk. What do you think their blood pressure is going to look like? Super low. So that means their heart rate's going to be high. I mean, they're bleeding. Do we understand?
Yes.
All right. We are going to put them on a high fiber diet. Why would I do that? Was that not a
Did you
helpful
make a
noise? I did.
Oh.
I made a push to poop noise.
So it's easier
We're getting
to poop. No
Why?
hemorrhoids.
Hemorrhoids, right? If you push to poop, it's going to make the hemorrhoids worse, right? You'll make me do that for nothing. Okay. And low sodium, we already talked about with the fluid retention. Yeah.
Mhm.
Okay. Let's talk about our reproductive system. Hyperaldosteronism. What is aldosterone's job?
Hold in water.
Hold in water and sodium, which leads to even worsening fluid retention. Correct. Testicular atrophy. What does that mean? Atrophy.
Breaking down. the-
So atrophy means like small or breaking, right? So put those two together. Teeny tiny
Small
balls.
testes.
Yes. What is gynecomastia?
When the males get.
So man boobs. Yep. Man boobs. What is amenorrhea? Girls have no periods. Okay. What is impotence? I don't know what impotence is. So pure, so young.
Oh gosh.
Impotence is when a man is not able to obtain an erection. Surely y'all have heard of this lots of times before. Oh, they're impotent. Yeah, they can't get it up. Okay. Nope. All right. All right. Y'all's brand new. Okay. Loss of libido.
Sex drive.
All right. So don't feel like having any sex, vaginal bleeding when you weren't supposed to, and no body hair. Now, why would they get all of these things? Functions. You can do it.
Because it metabolizes hormones.
Right. So the liver's job is metabolize and get rid of your hormones. Well, it can't do that. So all your hormones are going to build up in your body. So men become women and women are going to become men. It's going to offset their estrogen and testosterone, right? Plus they have hyperaldosteronism. We know aldosterone is a hormone, right?
Yeah.
And lots of aldosterone can cause women to get chin hair, which is called,
Oh.
starts with an H.
Hiroshima.
Hiroshima? Ma'am, that is not it. But it sounds like that. Hirsutism. Yes, it is hirsutism. So do you understand the reproductive portion?
Yes.
All right. Big 4 things your patients with cirrhosis are at risk for. This is the big ones. Like if they're asking priority. Number 1, infection. Why would they be at risk for infection? There's lots of reasons, but just name me a couple. Functions.
Mhm. Low white blood cells.
Okay. So the body is not able to, the liver is not able to make white blood cells, right? So they're going to be at risk of infection. And also, aren't they building up on all these nasty waste products that your liver can't get rid of?
Yeah.
So they're just sitting in like dookie, yes,
Yeah.
and can't fight off any infection from that. Yeah.
Yeah.
They are at high risk of bleeding because low platelets and
Clotting.
low clotting factors and low vitamin K. Okay. Hypoxia. Why would they be at risk of hypoxia?
Low red blood cells.
All right. So liver's responsible for making red blood cells. Y'all know your bone marrow does that too. Okay. But your liver is very supportive in that as well. They're at massive risk of hemorrhage because all the cells, but also esophageal varices. Very good. All right, quick note. So this is like your little cirrhosis cheat sheet. Okay. When a patient comes in with cirrhosis, how are we going to position them? they're full of fluid on their belly. If I laid them flat, how would they feel?
Yeah.
Right. Think of it as like they're pregnant, like, right? So you're going to sit them upright, semi to high Fowlers. We can bring that fluid up. Because what happens if I lay them backwards and all that fluid sits on their, or is like pushing on their lungs? What's going to happen? Very simple.
It's hard to breathe.
They can't breathe, right? So a lot of patients with cirrhosis will come in with dyspnea. So you want to sit them upright. Do we understand?
Yes.
Okay. We're going to do SpO2 monitoring because they're at risk of hypoxia. So we're going to put on a pulse ox. Why are we slapping on an EKG? Do you think your heart reacts well to sitting in waste products? Do you think you're probably going to have some electrolyte imbalances with all this fluid imbalance? We're going to put on bleeding precautions, which I'm assuming y'all know.
Yes.
Okay. Fall precautions and then pressure precautions. What are pressure precautions? Which, by the way, I made that up. Don't say that in class.
Okay.
Yeah. I mean, it should be a thing, but don't be like, and then pressure precaution. They're going to be like, what the? So what's included in that? Pressure. What would increase my pressure? Not blood pressure, just pressure in your body. Things we would not want them to do. Okay, say it in a different way. What in your body can increase the body's pressure that you would not want them to do because you don't want to rupture? Oh, coughing. Okay, so go along those lines. When you'll feel that in your head. Okay, so what else? Sneezing. That's a good one.
Would be like pooping.
Pushing to poop, which is
Vomiting.
another reason why we give high fiber. Vomiting. Okay, so pressure precautions means you're not going to have them do like bending over, right? All of those things can increase your pressure, which can put them at risk of a rupture of the esophageal varices. Do we understand? Okay. Why are we doing neuro checks?
Ammonia.
Ammonia. Why are we doing daily weights?
All the fluid.
All the fluid issues. Why are we doing good hand washing?
Because they're at risk.
High risk of infection. All right, so here's their diet, and you're going to give me a rationale for a diet with a patient with cirrhosis. First of all, we're going to put them on high calorie. How come? Losing what? Just losing in life? Oh, what is it? Oh. What does a patient with cirrhosis look like? Have you ever seen one? You can see them in the grocery store all the time. What do they look like? Their bellies are big, but their extremities are skinny because albumin. What's the other name for albumin? What is albumin? It's a protein. Okay. So they are protein wasting, right? They don't have enough sugar because they're malnourished, right? So then if they don't have sugar to use as an energy source, what do they have to break down next? Fat. Okay. So that's going to break down fat here. Their bellies are not fat. That's fluid. Okay. So they're going to start pulling from extremities. And then once they don't have any fat left on their extremities, they're going to start breaking down protein and muscle. So their extremities, very skinny, their belly, very big. You can spot this if you really know what you're looking for, right? Okay. So we're going to put them on high cal because they are typically malnourished, right? They usually will, and I can't say it across the board because that's judgmental, but a lot of times they will drink instead of eat, right? Okay. High carb. Why would I put them on high carb? Function.
Yeah. It creates carbs.
All right. So your liver, remember, will make sugar when you're not taking in sugar. That is called.
Gluconeogenesis.
Oh my God, you're so smart. Gluconeogenesis. So gluco means sugar, new, genesis, to make. So your liver performs gluconeogenesis when you're not taking anything in, but the liver is tired, right? And it's not going to be able to make those carbs. So you have to give them carbs. The other reason is, as far as gut is concerned, it's the easiest thing to break down on your gut, right?
Okay.
So we're going to do high calorie, high carb, moderate protein. They do need protein, but one of the byproducts of protein is ammonia. So if they get hepatic encephalopathy, you have to put them on a low protein diet. But all other cirrhosis patients, if they do not have hepatic encephalopathy, can just have a moderate protein diet. Why would we put them on low sodium? Fluid retention. Yes. Moderate fat. You obviously don't want high fat. That's hard for the gut to break down, right? But so you would just put them on moderate fat because we do need the calories from the fat. Okay. All right. Labs we're going to run very quickly. We're going to run through this. Why would I run a CBC on this patient?
Check their ribocells,
Ribocells, white blood cells, platelets, which will all be
low.
We're going to check their coags, which are going to be
Like clotting.
the clotting factors, which those are going to be
Low.
y'all Clotting factors are in time.
Oh.
So the time it takes them to clot is
Oh.
higher, so they're going to be increased.
Okay.
Okay. What's a BMP? Basic Metabolic panel, which just includes our electrolytes. We need to check electrolytes. Okay. Hemocolt. What's a hemocolt?
Something with the blood.
Yes. A cult means. Y'all heard of the occult?
Yeah.
Do you know who's in it?
Oh man.
Do you know who's in the occult?
Who's in the cult? You remember this?
I do.
Is it like widespread knowledge who is worshiping Satan? Okay, so it's yeah, it's hidden, right?
Hidden.
Hidden. So occult
Hidden
means
blood.
hidden.
Like in the poop.
Yes. So we do the hemoccult cards. You remember I talked about the windows of poo poo? Didn't we talk about this?
I don't remember that.
Oh, okay. So hemocold is like this little card like this, and it looks nice until you have to start digging in someone's dookie. So you will take a like a popsicle stick or like a tongue depressor and get some of their dookie. And then there's these nice little windows that you're going to open in the front of the card, and you smear their dookie on it, and then you close the windows and you're like, have a good day. Then you turn it around to the back and you open up the back windows. So you don't have to touch their poo-poo. Okay. And then you have a developer that's a liquid, and you put the developer on the hemocold, like on the actual poop. And if it turns blue, that means that there is actual hidden blood that you can't see with your eyes. And you have to do that 3 times from 3 different stools, because there's not going to be blood in every single stool usually, unless there's like a mat. Your face looks like you don't want to do this job. And you can actually do it at the bedside, or you can do it like on the unit. You don't always have to send that off. So if they're like, oh, go do a hemocolt times 3, which is what they'll usually order, then you need to wait for them to poop 3 separate times and do the hemocolts every time. Windows, hello. Okay. So we're going to do that. Okay. Because GI bleeds are very common with cirrhosis because they don't have any platelets or clotting factors or vitamin K, and they have gastric varices, right? So there's like all the esophageal varices. So chances are they're going to bleed in the GI system, and they're drinking alcohol, which is very, very irritating to the stomach and the esophagus, right?
Mhm.
All right. Why am I drawing LFTs?
Those are liver.
Yeah, because your liver just,
Jacked
it's not doing good. Yeah. BUN and creatinine. Why am I drawing those?
because they're married and they go together.
All right. So if the liver goes down, the kidneys are going down too. So the kidneys are going to start to fail as well. And that is called hepatorenal syndrome. That was nice the way that they named it, right?
Yeah.
Okay. Why am I drawing a GFR? Same thing. B vitamins.
The liver synthesized.
Liver synthesizes them, so we probably don't have them very well. Why are we drawing albumin? The liver makes albumin. It's probably going to be low. Why are we drawing vitamin K levels? Because the liver makes vitamin K, so it's probably going to be low, and the patient's going to be at risk of bleeding. Do we got that? Okay. Part 2. Oh. Second set of cirrhosis. Are we ready?
Mhm.
All right. Where is the liver located?
Right
Upper quadrant. So if they have cirrhosis, where they can complain of pain, right upper quadrant. If they have gallbladder disease, where would they complain of pain? Right upper quadrant, because it's right up underneath.
Mhm.
A?
Hey.
Okay, then. Okay, so let's do skin. The patients with cirrhosis will have jaundice because bilirubin is going to build up in the blood. What is bilirubin? It's a waste. No, well, a waste product of what? All right, so it's the byproduct of red blood cell breakdown. So when your red blood cells open, the jelly donut.
Yeah.
Okay, so all of that is going to come out. It's going to go to the liver, and the liver is going to metabolize it. And then how do you get rid of it? No, ma'am. Unless your spleen is pooping, which I hope.
Oh, you
does not
poop it
happen.
out.
Yes, it puts it into your intestines, and that's one of the reasons why poop is brown. A. All right, spider angioma.
Is that the one?
Stop that.
That's our.
Oh, yeah.
Yeah.
Okay. So spider angiomas.
Angie.
Angie.
Never mind.
What does Ange mean? Yeah, that's a good way to go about it. Thank you for saying that. Like angiogen. And an oma is going to mean like some kind of like almost like a tumor, but this is not a tumor, but it's like a collection of something, right? Like a sarcoma, like a, you know what I mean? So spider angiomas are like little
Spider veins? Is that what they
kind of like spider veins. Yeah. And they build up right underneath the skin, and some of them will actually rupture. So they're going to look like these. Why would you have that?
I've had those before. But they're not that like.
Oh,
Oh.
should probably get
When I
that
was
checked out. No,
younger.
no, sometimes babies can have
Okay.
angiomas. That's fine. So why would they have these little ruptured blood vessels underneath the skin? Blood vessels, ruptured blood vessels right underneath the
There's
skin
So much pressure.
from the
portal vein.
portal vein. So this is from portal vein hypertension that's backed up blood everywhere else. It's going to go underneath your skin. And then those blood vessels underneath your skin are teeny tiny and they will rupture. Palmar erythema. What's erythema?
Blood.
Red,
Blood.
y'all. It is
Just
redness. Okay. I mean, yeah. Okay. So it is redness and
Mhm.
that's also a blood issue, right? It's backup of blood. Yeah. I mean, you don't have a whole lot of blood in your palms. So you could probably fit a lot of extra. Burp, burp. Yeah.
Mhm.
Okay. All right. What is petechiae?
Little dots.
Little teeny tiny blood spots. What does it tell me?
You're bleeding.
You're bleeding. All our liver patients
Bleed.
bleed. Okay. Purpura,
Big.
big purple spots. That again is an indication of bleeding. What is pruritus? Itchy. Could be ammonia, could be bile salts. It's all that waste products underneath the skin. They will like scratch until the skin breaks. So, and then they're bleeding. Yes. And also infected because their skin's going to get massive infections because they're scratching and there's all kinds of waste products right up underneath their skin. Right. So we want to prevent infection. They've diagnosed patients with cirrhosis with no other signs and symptoms, but like uncontrollable itching. They go to dermatology and dermatology is like, oh no. Yeah. If you have a patient that just has itching and that's it, that should be a red flag for liver. Okay. So what are you going to do to prevent infection when they scratchy scratch?
Oh. Wash your hands, clean your nails.
Wash your hands, keep your nails short, right? So that when they scratch, it doesn't like, because, you know, it'll get stuff underneath the skin and they scratch somewhere else and they just spread staph all over the place or whatever, right? Okay. We can also use a drug called hydroxyzine. It's like a beefed up Benadryl. Okay. And we use it specifically for itching. It is an antihistamine. Okay. So I'll know histamine builds up underneath your skin and makes you itch, right?
Yeah.
Billy lights or indirect sunlight. So, you know, that sunlight will help you to break down bilirubin in your blood. That's why, have you ever seen babies under Billy lights? You probably have. Yeah. Do you know what I'm talking about?
Yeah, I do now. I didn't know what that meant.
Have y'all seen it?
Mhm.
Okay. So sunlight helps to break down bilirubin. So we'll tell they either need to go under lights. Most of the time we don't do that for adults. We'll just tell them, hey, go get in the sun, but we don't want them to burn. So we'll say indirect sunlight, which means through a window. So stand by a window and get some sunlight. Okay. And then Benadryl and lotion will help some with the itching as well. With me? So we're going to watch our bilirubin levels, tell the patient to report jaundice. Why am I putting them on fall precautions?
Because I'm bleeding.
Meticulous skin care, very important, and look at their skin every single day from head to toe. Why are we turning Q2? Don't they have a lot of fluid?
Yeah.
Okay, if they have fluid retention, then that means your skin is just sitting in water, which puts you at high risk of skin breakdown and pressure ulcers, right? Okay, keep their nails short, very good hand washing. Do not use an alkaline soap because it will break down their skin. Okay. All right, GI. There's a lot of GI a lot of GI symptoms. Okay. Anorexia. Why don't they feel like eating? Maybe there's a lot of fluid. The ascites makes you not feel like eating. Also, you know, no big deal. Your stomach's kind of bleeding and they typically tend to drink rather than eat. They don't feel like eating, right? Hematemesis. What is that? Vomiting blood. Why would they do that? So, and they don't even have to rupture, right? But they do have gastric varices, right? And then they drink alcohol. Don't you think that's going to make them bleed in their stomach? And yeah. Fetor hepaticus. Sounds like feces. Yeah. But it's in your, remember we talked about poo breath?
Yeah.
Yeah. So that meant when their breath is like really, really bad from all the buildup of all those waste products. Okay. Hepatomegaly. What's hepatomegaly? Yeah, of course it is. It's cirrhotic. Yeah. Okay. All right. Nausea, vomiting, abdominal pain. What is dyspepsia? What does pep mean? Like pepsin is found in your stomach. Dys means something is wrong. So dyspepsia just means stomach upset. Yeah. And why would they have all that? The gastric varices and like, you know, they're drinking alcohol and the stomach is probably already like really irritated. Weight loss. Why might they have weight loss? They're not eating, but they may also have a rapid weight gain that's just fluid, but we can take that back off. Does that make sense?
Yeah.
Okay. Right upper quadrant pain, obviously their cholesterol may be low. Why would their cholesterol be low?
Can your liver make?
It makes cholesterol,
Mhm.
right? But it also helps get rid of cholesterol. So they may just have cholesterol issues, but you need cholesterol. Cholesterol is not bad. Cholesterol is very good. What is cholesterol's job? It's the main component of your body's cell membrane, of every cell in your body.
Okay.
So if you don't have a cell membrane,
Yeah,
right, that's the cell like the cell wall, right? It also helps you to absorb vitamin D. So that's also an issue, right?
Yeah.
Right. So we're going to do a high calorie, high calorie, high carb, low fat, low sodium diet. We're clear on this.
Mhm.
Okay. We may give antiemetics. What are antiemetics?
Non-throw-uppers.
Non-throw uppers. I love that. Okay. And what are the examples of non-throw uppers? So Frane, which is on Danzatron. Okay. And then promethazine, which is Phenergan, correct. We're also going to give PPIs. What are PPIs? Proton pump inhibitors. They end in Prozol. Nailing it. And what do PPIs do? You know what? I'm scared for you to answer, but just go ahead, put it out there. What's the job of PPIs? Okay. What?
like stomach acid?
Yeah, decreases stomach acid, which is good because if you already have bleeding on your stomach and you're drinking alcohol, the last thing you want is a bunch of acid sitting on there, correct?
Yeah.
Okay. H2RAs, what are those? What's H? Histamine. So histamine 2 receptor antagonists. What do they do? Same thing as PPIs.
Yeah.
They're going to decrease acid. What do they end in? Tidine, Tidine. Boy, farm's going to be a real treat for all of us, isn't it? Okay. Very good oral care because
Bad breath.
food breath. Yes. All right. We are going to put them on at least 3,000 calories per day. That's a lot. That's a lot. But they need it, right? High carb diet. We know that, right? Daily weight, because that's the best indicator of fluid balance. Small frequent meals. Obviously they're not going to want big giant meals. You're pretty much always going to pick that. When are you ever going to pick one big giant ass meal a day? Like, you're just not going to do it. Oral hygiene before meals, that will help them because you don't want to eat a meal when it tastes like poop, right? So yeah, so do oral care before meals. I never used to pick that on exams because I was like, who wants to brush their teeth right before a meal? That would taste awful, but it would taste worse if you had to taste waste products, right? Allow the patient to choose their own food preferences. Very important. Because if we just need them to eat, I don't care what you want to eat. You want to eat Takis? Okay. You know, we just want them to eat something. Okay. Monitor for black tarry stools. What does that tell me? They have a GI bleed, and that does need to be reported. It's not super urgent, except for in liver patients because they bleed, right? All right, next is hematological, so blood. Why would they have thrombocytopenia, anemia, leukopenia?
Because the
Liver makes red blood cells, white blood cells, platelets. They're going to be at risk of what 3 things? Number 1, infection, bleeding, and hypoxia. Very good. Okay. They may have petechiae and purpura. We talked about that earlier. What is ecchymosis?
It's coughing. No.
Ecchymosis. Yeah. It's just a fancy word for something. No, that's epistaxis. Ecchymosis means bruising. Bruising. What does ecchymosis mean? Bruising. What are the 2 drugs of choice for hepatic encephalopathy?
Neomycin,
Lactulose and neomycin. Thank you very much. All right. Bleeding, splenomegaly, we already talked about. Here's our friend epistaxis, which means nose bleeds and their vitamin K will be low. We've talked about all those. Y'all feel comfortable with that?
Yeah.
All right. So they may need blood transfusions. Okay. But you have to be careful with this. If this patient is in like fluid volume overload, they're retaining fluid, you want to give them whole blood. Maybe, maybe not. Probably not, because they don't need the volume. They probably just more need the red blood cells. So you can give them packed red blood cells where it wouldn't be the volume. Okay. And then what is fresh frozen plasma? What does that have in it? Why do we give that to patients? Oh my God, you like woke up. So fresh frozen plasma has clotting factors. So we would give that to the patient to replace the clotting factors. That would be if they were acutely bleeding, like a ruptured esophageal varices. Okay. They may need platelet transfusions and they probably will need vitamin K injections. Okay. We already knew we were going to put them on fall precautions, and bleeding, and pressure. We're going to watch out CBC, watch our pulse ox for hypoxia, let them rest a lot, watch those coags. What are my coags going to look like?
Increase.
Thank you so much. Yes, they're high because it takes longer for the patient to bleed. Yes. Monitor for hemorrhage. Thank you. To clot. Y'all gave me a disease. It's called, I don't know anymore. Okay. Renal. All right. Y'all understand hepatorenal syndrome. We talked about that. That will lead to renal failure. Yeah.
Yeah.
Okay. So we will start seeing oliguria. If we start seeing that, we're like, oh, shoot. Okay. Now, not all cirrhosis patients have that. Okay. If at the beginning of cirrhosis, you won't see anything wrong with the kidneys, but as it progresses, you will. What is azotemia?
A buildup of waste products in the blood.
That is true. I know, she was like woke up all of a sudden. So azotemia is a buildup of all the waste products in the blood. So you have like waste product blood, right? Dark urine. Why would they have dark urine? Their urine turns dark and their poop turns white. You remember this?
Yeah.
What gives the brown color to your poop? Billy. So it can't, the liver can't get it into the intestines. So it's sending it to the kidneys. So the poop will become, they'll call it clay colored stool, right? And the urine will become dark because it's trying to get rid of the Billy. Got it?
They put it on the test as amber or dark brown.
Yeah.
What? Oh.
What color will the urine be? Amber or dark brown?
Oh, yeah, that's kind of stupid.
I know.
But amber, I think is more of like an orangey color, not like orange. It's like an orangey brown.
Yeah.
Dark urine, I think, is more like a deep brown. I don't know. Anyway, it depends on what they were asking you. All right. So how do we fix the kidneys? How do we help them get rid of waste? Yeah, we're gonna have to just dialysize them and help just take all their blood out, clean it out, and give it back to them all nice. So we're gonna watch BUN, creatinine, GFR, daily weights, isonos, and electrolytes, because as they go through dialysis, electrolytes might be good. What are the 3 electrolytes your kidney's supposed to get rid of? Number 1. This is very basic. Sodium, potassium, and chloride. Okay. So you're probably, as they get kidney issues, they're going to have issues with those electrolytes. Yeah. All right. Let's talk about our metabolic issues. What is uremic? Anytime it says uremic, that means a buildup of uric acid. And the same way the blood from the portal hypertension had to find a place to go, so does the uric acid. So uremic fetor is in the mouth. Uremic pleuritis, where's your pleural cavity? Around the lungs. So these patients may have acute dyspnea, and it hurts when they take a deep breath, right? So it's hitting that pleural cavity. Uremic pruritus, that's itchy, so uric acid under the skin. Hyperammonemia, we already talked about. Asterixis, we talked about. Hyperuricemia, hyperbilirubinemia. Now they might have hypokalemia or hyponatremia. Now, why would they have those? Okay, so I believe that the extra fluid could dilute your sodium. Absolutely. Now, usually sodium, potassium are going to go on a seesaw, right? But in this case, that's not going to happen. They're honestly, at this point, they're not eating really anything. So we're probably not taking in enough potassium, period. Okay. All right. So what you're going to do is treat them with colchicine, probenecid, and or allopurinol, which are all of our gout drugs. Yes. Lactulose and neomycin, which treats hepatic encephalopathy or high ammonia. Benadryl or diphenhydramine for the itchy. Potassium supplement for hypokalemia, and then spironolactone, which is spironolactone is a potassium sparing diuretic. That would be a great drug to use, right? Because it's going to help get rid of the extra fluid while also helping to maintain their potassium. Got it?
Question.
Okay, Dwight.
Love that stuff.
Beats.
Doesn't gout medication, like, isn't that bad for your liver?
Yes.
So why does this make sense?
Well, that's a very good point. Yes, it is very hard on the liver. But so is your body sitting in uric acid. So we're just going to play a roulette game and see what happens. Spin the wheel. It's like we're like messing up one thing to fix another thing.
Right. Risk
Versus benefit. That's a good question. All right, for the uric acid, we are going to monitor their uric acid levels. If they start having chest pain, that does need to be reported. Okay, they're not having a heart attack, but we do need to treat the pleuritis. Okay, because your lungs don't want to sit in Uric acid. Good hand washing and lotion. We talked about that. Watch their bowel movements, right? Their stool is probably going to be clay colored, right? Limit physical activity. So we want them to kind of chill out, especially if they have high ammonia, because your brain is sitting in, right? Report new onset confusion. That's your big thing, right? What's the first thing you do for hypokalemia if you think your patient has a potassium problem? EKG. Okay. Then we're going to watch their BMP, which is basic metabolic panel that has our electrolytes in it. And then we're going to watch for any new neurosymptoms. Do you understand that?
Yes.